Alright, in this portion of the video we are going to show you what you're going to be doing back in the testing room. This is your testing station that the state mandates that you do to pass this course. You have to do 3 sticks. Everyone gets a baggie full of sterile equipment. You notice on your checklist it says that you have to prepare this, get it ready, and this isn't going to be a big deal. Usually your instructor will have this all ready for you. But you do have enough supplies to do 3 sticks. 2 of them are going to be angiocaths. The other stick is going to be a blood draw. And you have alcohol for each stick and Band-Aids for each stick. What I would recommend is you get everything ready beforehand. So for your IV, this is a twist and tear. You can actually get these ready even before your stick. Twist, and whatever comes off first is throwaway. So we're going to toss that, and this is ready. Do not loosen this cap and uncover the sterile part of the angiocath until you're ready to stick the patient. So that is ready to go. And before I twist and tear anything, I'm going to read and make sure that it is exactly what I want. 22 gauge 1 inch. It also has an expiration date on it, 2017, and then I can go ahead, twist, tear. This comes off first. I know it's throwaway, so that's ready to go. For this, a lot of hospitals have gone to the cheaper version. They're watching their budget. Again, this is twist and tear. I've already checked the expiration date. Once I twist and tear this, I will screw it in the top, and this is now ready to go. I will put my tube, again, checking expiration, and if it's the test I want, according to the doctor's order, I will make sure that is on the side that I load. You're always going to load your tube with your non-dominant hand, so it's on my left side because I'm right-handed. I will also get my Band-Aids ready. Now you cannot stick this to anything. You can't stick it to the side of the table, to the top of your glove. So what you have to do is just keep it on one side of the sterile packaging. And you can get this all ready also. And if you can all jump in and help, your instructor, your partner, all of that, they can all help out. Okay, and here's my alcohol wipes. So I am absolutely ready for 3 sticks. At this point, I do have my gloves, but I do not have to put these on while I'm looking for my vein and also putting on my tourniquet. If they had a kind of an oozy skin condition, I would absolutely put gloves on with my tourniquet. So since he has 3 very nice choices, and again, basilic should be your last choice, even though you can absolutely use it, just be careful. I've got a cephalic, and I have a very nice median cubital. Even though I can see them, I'm always going to put my tourniquet on. So just like what we practiced, okay, tourniquet's on. Now what I'm going to do is watch these dilate. Look at how nicely they come up. I have a median, I have the cephalic here, kind of hairy, so it's not as easy to see, but I can still see it. I have a very nice median cubital, and my basilic is coming up nicely. I'm going to use the median cubital. So now I can put my gloves on because I am going to prep. Make sure you have a nice fit on your gloves. I don't want any fingertips too long. I can pull this back and just make sure I have a nice fit. These are actually a little bit too big, but I could go down to a medium. Alcohol is what we're using. And since I do have the vein I want, I'm going to use friction, clean to least clean. Now I can save this because it's the same patient and it's still wet, so I would be able to use this again. Okay, so there it is. It's nice and plump. This is on nice and tight. When I take this off, bevel up. Have your gauze ready because you're going to be using that at the end. Got a fan on. Now I'm going to anchor. Remember, anchoring is super important. Now if I had to touch this again to see where it is, I can, but what do I have to do after that? I have to clean it again because my glove is not the cleanest thing. Okay, so what I'm going to do, 2 fingers underneath my thumb on top. 2 under, thumb on top, and that's because I'm going to rest all my weight on these fingers after I go in. So I'm going to pull tight, I'm going to insert nice and quick, and just rest. Take your tube, we're going to load it like a syringe. Once you get that in, You can see the blood. Since we're testing, we don't have to fill it. Out it comes. Get your gauze ready. And see how this has not moved. It's like stone. Fold this in quarters. Do not put pressure over this. Actually, turning it off. Do not put pressure over this. Just hold it over. Don't put pressure on it because you'll cut the patient. Out, then pressure. I'm going to have Richard hold this. I did it kind of fast. I forgot. Usually you take your tourniquet off after you take the blood tube. After there's blood in the tube, you can take your tourniquet off. But it was kind of fast. You will be giving this part to your instructor. The instructor will unscrew the needle in the sharps container and take care of your sharps. Okay? So that's taken care of. He's still holding pressure. You have to hold pressure on this at least 2 minutes so you don't get a bruise. Now I'm going to make sure that that gauze is wadded up nice and tight. So I'm going to even, as I apply pressure, never release it. Super tight. We're making our own pressure dressing. Tight, tight. So that acts like a finger, that wadded up gauze. So it pushes down on that hole that you just made, and it keeps pressure on it till the platelets can come along and plug it up. So that is your blood draw. A few things I want you to remember. As soon as you push the tube in and you see blood, tourniquet off. You don't need that pressure. And you can only keep your tourniquet on for 1 minute anyway when it comes to blood draw. Okay, our next one, we're going to go right down to the hand. I'm going to move Richard up a little bit. The more I can have his hand in a downward position, gravity is going to help. So that's a good thing. I'm going to sit for this because I am tall, but it's up to you guys if you want to sit or stand. Okay. I'm going to have all my supplies nearby. Always have your supplies nearby. Now this is a hand stick. With your hand stick, tourniquet 6 to 8 inches. Tourniquet. Oop, on the floor. I'm going to clean this. Do you want to do a take 2? Okay. Yeah, we cleaned that. Okay. So, if I'm going to stick Richard in one of these 2 veins, he's got several nice choices. 6 to 8 inches, again, make sure they're even, make an X, hold this above his hairy arm, a little bit of a nipple there underneath, and look at how this comes up. But I don't want it this is way too much pressure. As soon as I introduce a needle into here, I might have a little backflow. Way too much pressure. So I'm going to release this and put it on a little bit less tight. Oh, now it's soft and resilient, but I can still see it, just less pressure. He's very healthy, he's young, so I don't need to put that much pressure on. So which one would you guys choose? This nice big one? Always pick the best vein. But this is also good. This is bigger than most individuals. His smaller vein is bigger than most of our patients' veins. But I'll pick the big one. You know what I usually do is prep the entire hand in case I change my mind at the last minute. You never know what your veins are going to do. So I'm going to prep the whole hand, keep it nearby. Okay, now this, super important that you put lots, he's young, he can take it. Got to keep that hand super tight. And you're going to do a quick controlled stick. Now I'm going to release my anchor. Always take off your cap with 2 hands. Always remove it with 2 hands. You're going to go side to side to make sure it's not stuck. Never go up and down. You may cut your catheter. But they always stick these at the base at the manufacturer so they don't move around on transport. So, side to side, bevel up. Now, unlike our blood draw where we had 2 fingers under and 1 thumb on top, that would get in the way of our angle of entry. So I'm going to put my hand on the top. I think I might have touched it, so I'm going to wipe it again. Now again, this is where anchoring, super important. Now do you see my tripod? See this finger? I'm going to make sure that this is somewhere, the table, my hand, his hand, but somewhere I'm going to make sure my hand isn't shaking. If I just hover over the vein and I'm nervous, I'm going to shake all over the place. So I'm going to do an anchor here. Now this has got to be super low, super tight. See that angle of entry? What would you say? 15 degrees? And just before I go in, I'm going to push down a little, straight in, and flatten out. Do you see that? There's my flash. So it was a quick, as soon as my angle I got through the skin, I leveled out straight because the vein is parallel with the skin, stayed nice and superficial. As long as this fills up, I am still in the vein. Tourniquet off, get your gauze ready. I'm going to gently let go of my anchor. Fold this in fourths, no pressure, grab the blue. Everything comes out at one time quickly. And make sure you get rid of your sharps. Have Richard hold it nice and tight. Get a Band-Aid. And don't touch this pad when you open a Band-Aid. Don't be afraid to open your Band-Aid. I'm going to put it on super tight. And what he can do while we stick the other side is to hold this higher than his heart. Okay, and continuing with our video on how to start an IV and blood withdrawal. We've done one blood withdrawal, which is how you're going to do it in testing. In live testing, you're going to do the blood withdrawal first. Then you're going to do an angiocath in the hand, which we've already done. Now this last IV, you can start it anywhere you want in the other side, the other arm. You can do a hand, a wrist, a forearm, antecubital. The antecubital has less nerve endings, doesn't hurt as much as the hand. So if you do have a nice vein in the antecubital, this is for testing. We want to get the best vein that we possibly can. But look, I don't know if you can see the color, little green here, that's a vein, very nice vein. He does again have the 3 different branches up here, and he also has some nice wrist and hand veins. So we're going to do the antecubital, our third stick, which is an IV angiocath. Put the tourniquet on again, little nub underneath, and even over close, this does very well. If I need to do this, I could have him squeeze his hand. And remember, when we do IV therapy, you can stimulate with squeezing, with a ball in their hand. You can have them open and close their fist as much as they want. With blood draw, you cannot do that because it turns out all that squeezing tends, and all the pressure of the tourniquet tends to send all those analytes out of the vein, your electrolytes, and your lab values are affected. That's why there's a 1-minute tourniquet time with blood draw and no squeezing of the fist with blood draw. But IV therapy, do it as much as you want. So now that the tourniquet is on, I have 2 minutes. Get my gloves on before I do my prep. So I have my sharps container ready. I have my Band-Aid ready. And again, I'm going to prep all 3 of my choices here. Save my alcohol. And you'll notice he has a very nice basilic, my last choice, median cubital right in the middle, which is why it's named that. And then his basilic is over here. See this little tiny branch here? That's a skin branch. That doesn't count. His basilic is much deeper and it's really hard to see, but I can feel it. It's a nice big fat vein. But I'm still going to go for the median cubital. Okay, let's wash it again. Now in this example, and thank you, Rich, for doing all this. For this example, the state does not allow us to thread. It's too invasive, but I do want to show you a one-handed thread that you will be doing once you leave here. You will be doing your threading and connecting, but I do want to show you what it looks like in real life to thread. So again, good anchoring. My bevel's up. I made sure that it's not stuck at the base. And this is where I start to see the color of the vein here. So I don't want to go too high because I have to have room to thread. So I'm going to anchor. This hand, I'm going to make sure I do a tripod here. I'm going to enter here very quickly. And you see the flash? So that means I'm in the vein. I want to go a little further to make sure I'm in all the way. And what I'm going to do is kick this off, a little bit of a gap, and I'm going to just push and not drag it on his skin, but I'm going to push it all the way in, and that's it. So what I would do after that, tourniquet off, and then I would remove the needle with my V and I would connect it. But today I can't do that. So what I'm going to do is get my gauze. Now you guys understand this was just for an example. We will not be threading in your testing station. You're just going to be finding the flash and you're done. But in this case I did thread, so I'm going to have to remove them both at the same time quickly. Lots of pressure. Have Richard hold on to that nice and tight. But again, you will not be doing the threading and testing, only in real life. But it's nice to see what it looks like because you guys will be doing that. So as long as this is on nice and tight, it acts as a finger putting pressure. And they did discover, see how Richard just bent his elbow? They did discover that this does not help when you do this, because actually the vein sinks and you can't put direct pressure on it. So the best thing you can do is just put pressure on it like that. Okay, so remember, when you come back for testing, it is blood draw first, IV angiocath, and then IV angiocath. All you have to do is get flashback, pierce the skin, get flashback, and you're done. And with the blood draw, you just make sure when you pop the tube in, you get some sort of blood in your tube, and then you're done with that also. You can remove the tube and take everything out. And that's it. Good luck, you guys.